the main reason we give CPR is hopefully to give a person a chance at life, okay? When we do CPR, what we're doing is we're pumping down on the chest and we're pumping that blood to the vital organs, mainly the heart, the lungs. But the main thing we're doing is we are keeping their brain alive until more advanced medical care can arrive. Of course, there's a variety of situations where somebody might need to do CPR. Often, especially with summer, we think about drownings, there's heart attacks, respiratory situations, especially in children. And then, of course, people could become electrocuted, severe allergic reactions, accidents, severe bleeding that can cause people to stop breathing. Anytime we find that somebody's not breathing or they're not breathing normally, that is when we would want to begin CPR. The first thing somebody should always do when they determine that they need to help someone is always check the area. Make sure it is very safe for them to approach, because the bottom line is if something happens to them, then we have two victims, and of course that's of no value. So check the area, make sure it's safe. Once they check the area, they kind of go up to their victim and see, are you awake, are you awake? And if they don't respond, it's very important they call 911 immediately. And then they check to see, is their victim breathing or are they breathing normally? And if your victim's not breathing or they're not breathing normally, on the adult, we're going to go directly to compressions. And again, the main reason for that is because generally it's heart related and we want to get directly to compressions. We're going to do 30 compressions to breaths, 30 compressions to breaths. On our child, we're still going to check for breathing and are they breathing or breathing normally. But on a child, if they're not breathing or breathing normally, we're going to give the breaths first. And the reason for that is the majority of the time when your child goes down, it's respiratory related. Then we'll go to the compressions. But whether it's adult or child, it's always 30 compressions to breaths 32. That stays exactly the same. You should continue CPR until, if you're in an environment where they have an automated external defibrillator, it arrives. And then you're still going to do CPR in conjunction with that, or until trained medical help arrives. You see signs of life, the scene becomes unsafe, you can't stay there anymore, or you become so tired, you're going to keel over, you're going to pass out, you're going to become the victim. And maybe there'll be somebody else there who can take over and continue CPR for you.